So, hey everybody, it's Ben here with IV Drip Launch, and today with us we have Ashley Weiss. She's actually getting ready to open her own clinic. So, part of what we like to do is just share stories of other people that are getting into this business, share a little bit about their journey getting into the business, learn a little bit about them, and hopefully inspire people who are wanting to get into this business, hopefully inspire you a little bit to maybe take that first step. So with that, Ashley, how are you doing today?
I'm doing great. How are you?
I'm good. I'm good. Yeah. So I read a little bio that you had written out, like on your background and kind of what led you to this point. So maybe if you could share a little bit about who you are and kind of where you came from and where you're at today with opening your business, Serenity Springs Health and Wellness.
Sure. I've been a nurse since 2012. Really was just drawn to the profession and feeling that I could make a difference. So I wanted to learn how to do everything. I went directly into the ER and, just as a new grad, which was a little intimidating, but I'm glad that I did it because it gave me an amazing, well rounded experience at the bedside with all kinds of patients. And I absolutely loved it. As I progressed along, we were in the middle of an opiate epidemic with chronic nursing shortages, and I worked all the time. I didn't get the time with family that I wanted to. Even though I loved patient care, I was so drained when I got home that I didn't even feel like I had time to dedicate to my family or to my home or the things that really are important, the whole reason that you're working. So as time went on, I kind of found out that there were some treatments that were not even offered to people that were dealing with addiction. And the more I found out about it, the more I wanted to get away from standard protocols that were kind of aged and not really up to date with, the things that are available out there. And I just got really burned out. I wanted to spend more time with my daughter, and I started looking at different ways to be more independent and be more autonomous with the skills that I have. And I've kind of always had an entrepreneurial spirit. I like to, get out and um, do things my way, but still a right way, still with outcome based, patient care that's evidence based rather. And so this has kind of led me on my journey out of the hospital and into my own business.
Mm-hmm. Mm-hmm. Yeah, it sounds like you have a couple passions. One would be addiction and recovery. Tell me a little bit more about that.
Well, whenever I was working in the hospital, I ended up on antidepressants personally, and I wasn't like addicted to opiates or any crazy stuff like that. But I was trying to get off of my own antidepressant, which I could not seem to accomplish. It was the side effects were a lot worse than what anyone had told me. And the more I researched and found actually online boards of people who were trying to get off of the same drug were going through a miserable time. And the doctors literally were never educated by the pharmaceutical companies that this was even a problem. And then they would use euphemisms like discontinuation syndrome or ways to soften it up. And I was doing research to help myself. And one day, instead of typing in addiction withdrawal treatment, which there really wasn't a lot for antidepressants anyway, I typed in cure kind of on an accident. It was like a slip of the finger or something on the keyboard. And I had an entire world open up that there are actually treatments that you can take that with one dose cure addiction. And I was really blown away because these treatments are available in Canada and Mexico and all over the globe, but not the United States.
Right,
And the
right.
more I did research, I fell into amazing tons of research that had been available since the 60s and found out that there was an entire drug class called addiction interrupters. And I was like blown away. It was like a
Yeah.
thread that unwove the reality of what I saw as a nurse for seeing people, in the ER. 80% of the people that we're seeing, I'm guessing around that number, maybe more, maybe a little bit less. I've seen them last week. I've seen them last month. These are what we
Mm-hmm.
call frequent flyers. I've seen them mocked
Mm-hmm.
by doctors after they've created addicts. Like, I was disgusted with it. And the day that I found out that drug class, I had just intubated a 14-year-old from a fentanyl overdose. And I'm
Oh,
sitting at the
wow.
bedside waiting for ICU transfer. And it
Mm-hmm.
just, I was like, how could we have had this this drug class available since 1965, and yet here I'm sitting next to these people that are overdosing on a daily basis. And it just really drastically changed my perspective on what's available for nursing and how I could be an agent of change in the field. And so that has really been my passion. Not only did I get off my antidepressant, and I'm helping other people now to get off things like Suboxone and fentanyl, which they felt that they were going to be tied to for the rest of their life, with very minimal withdrawals and without a lot of drugs. I'm not giving them more opiates to get off. So IV therapy is a huge adjunct for that, because detox is not easy. Giving somebody a dose of vitamins and minerals and really supporting them has been just integral in helping them get off and let go of this stuff, in a way that they still feel energetic and still feel like they're, not just struggling through by themselves.
Right. Awesome. Yeah, no, it's obviously a real problem out there, and addiction is a passion of ours too. We have 2 clinics in Arizona. Lindsay, my wife, she's a nurse practitioner, and she has a passion for addiction. It affects, I think, at some level affects everybody. Whether it's a family member, or somebody or patients that you're treating, or whatever. But it's such a widespread problem, and having these alternative ways or options out there to treat and help these people is pretty incredible. So
it
definitely.
is. It's exciting. The technology that is finally becoming available again. It's been around since the mid 60s and has been suppressed. Doctors have been called quacks. The FDA approvals have been slow to come because they're so expensive for the double-blind trials. But the device I'm using is percutaneous nerve field stimulation. We put some frequencies on the ear, and within 30 minutes, you're making your own endorphins again, like you did when you were 9.
Yeah. Wow.
And you get to wear the device. I mean, the FDA approval is 5 days. If somebody's getting through, you're not going to get through a Suboxone detox in 5 days. That's more of a 10-day thing. So
right.
But I'm right there with them every day. We just use very little supportive medicines like Zofran, gabapentin, things like that, just to help with some little symptoms that they have. It gets rid of about 90% of all withdrawals. So
cool.
It works. I've had a great success rate so far.
Yeah. No, awesome. So I think it's super cool that you're going to have some of these specialties and these really hyper focused areas when you are opening your business, and these are, you're really targeting specific patients that you want to see, and things like that. So I think that's going to give you an advantage, definitely. So hopefully become like the authority in your area, as
I hope so. It works also for post-surgical pain management, so you can put it on after surgery and not have to take opiates. And it's fantastic with multiple treatments for reversing neuropathy. So there's a little spectrum, but it's still, a very small spectrum, but it's still the only kind of treatment, that really is focused on that. So it's great for wound healing too, strange enough. And it's also FDA approved for IBS. So, it's just getting the knowledge. I was like telling people, hey, this treatment's available, because there's such a lack of knowledge from everyone. Whenever I tell somebody, hey, you want to get off that Suboxone, I've got this thing that goes on your ear, they think I'm absolutely through the wall bonkers. They're like, what?
Yeah.
But IV drips, is a bread and butter thing in between people that are coming in for addiction. I live in a tourist town, so we have a ton of party animals at the casino, at the race meet. We have 3 lakes here. And it's a national park too, so we get a ton of visitors in. I have people call me all the time. They're like, I was on the lake drinking, whatever. I'm hot and I'm tired. I'm dried up. Could you come see me? Absolutely.
Right.
I've done like coasters at the bar, and like those little cardboard coasters, with like my number on there. Like, if you feel bad tomorrow, and that's helped. I've actually gotten a few people off of that.
Wow, those are awesome tips. So tell me a little bit about when you were getting started, or before you were taking steps to start your business. Like, what were some of the fears or concerns that you had? Like, how did you get over that to actually take steps to start opening your business?
Yeah, it's very overwhelming at first, thinking about how do I build a website? How do I get a medical director? What about the liability insurance? What risk am I putting out with myself out there to, if there's a problem with somebody? And, you know, the thing is, if you do a proper assessment and not just on the patient, you're doing research. There's a lot of companies out there that are actually built for nurses right now, like as far as insurance companies, you know, for you to work on your own. And because I
Right.
wasn't, ever taught of how to do this, I took a lot of research in the beginning. I wish that I had just gone straight to a class. It would have saved me a lot of time, because all the information is right there and aggregated for you, if you take a class. And because vitamin drips are what I call like the wild west of medicine, because it's like everybody's kind of got a different little formula that they like to use. Even the compounding pharmacies have different formulas that they put under a different title for their hangover drip,
Hmm.
or their post-surgical recovery drip or whatever. But um,
Right.
finding a good simple system I think starting off with a simple menu of the most popular drips, getting your liability insurance. I lucked out and found a local doctor here, from a
Oh,
medical
nice.
director. So
Yeah.
I could have gone with Guardian or Doctors for Providers or something like that, but I ended up not having to do that. So
Hmm.
that was the
Hmm.
most
Okay.
intimidating aspect of it.
Yeah. Yeah. And you found somebody local and somebody you're comfortable with. So that sounds like
Yes,
it'll be a good relationship.
yes, it has been. It's been great.
Nice, nice. Yeah, no, that's awesome. And a lot of these services that you're going to be offering, some of them are complex, and I know some people are nervous about them. One of them is high dose vitamin C, like we've already talked about a little bit. But what is this treatment going to be, I guess, most commonly used for in your practice, and who's going to benefit from it?
For me, it's going to be for addiction. It'll be for
Mhm.
the post care follow up. I don't do a lot of detoxing during the device. You don't
Mhm.
want to add on to the detox. You let them just do it naturally because the symptoms can be worse. But
Mhm.
after the device is gone, and people still they'll feel good for a little while, but they might still have cravings. But the high dose vitamin C is going to assist with those cravings overall in the long term and help do repair for neurotransmitters, inflammation, and things from the damage that have been done from the drugs. And
Mhm.
everybody's a little different depending on the dosage and how long they were on it. But I
Right.
do a send off lab at my place, so I can always do baselines on everybody. And of course, for the genetic testing that you need for high dose vitamin C, I'll have that right in there. I use AccuReference. So
Mhm.
they came in, set me up with everything that I needed, the computer, all the equipment, and everything. And you can even bill insurance directly from their computer, and you just mail it out. They're
Yeah.
fantastic.
Yeah.
So
Awesome.
that can sometimes, I think, deter people, like, oh, you got to do lab work on this first. Or even some people have been looked down on with IVs, that I've heard of, especially like in Louisiana. There was some stuff about it where they were like, oh, they're not even doing baselines. They don't know what people need or what people, if they're doing any good or what. Well, I'm trying to add that extra layer, and it was not hard to get that set up. And now I have it all right there at my fingertips. So,
Yeah. Cool. Awesome. Awesome. Yeah. No, I think that's yeah, I think that some of the key points, when you're want to offer some of these specialized treatments is just, make sure that you're comfortable with it, right? You do the research and you learn what you need to learn, and also having, obviously your pharmacist in place, and a good, medical director provider that's working with you. So developing a good team around you.
yeah,
And then, yeah, just understanding, ultimately at the end of the day, we just want to keep our patients safe, right? So, but a
ultimately,
lot of,
really big.
yeah.
I'm sorry to cut you off, but I have little binders, like I have very organized on, okay, if I want to give this medication, What are my contraindications? What are they going to be like? It's all right there. My standing orders are right there. When you would not give it, when you would give it, what you don't give it with, all those things, and having it right there at your fingertips, or even a little small flip book that you can carry with you if you're mobile, so that there's no questions at all, and reviewing that until you know it like the back of your hand. And it just comes with doing it, just jumping out there and just doing a proper assessment,
Right.
and following your protocol.
Yeah. Yeah. Awesome. Well, cool. To transition just a little bit here, for those that are looking to get into this business or want to start their own business, like what do you see as the biggest opportunities right now? Like, in IV therapy, like you're going to be specializing in addiction and a couple other things. Like what are some big opportunities that you're seeing for people to really look at right now?
I think that there's going to be a huge market for post-surgical care. There is a huge aging population right now that you have that are elderly, that may not have a family member that's close. They may not have friends. They may not have someone to pick them up after surgery and take them home and get their medications set up and make them feel like, because there's a gap in care there, huge. And it's, patient education after a surgery and actually understanding what they're supposed to do, what they're not supposed to do. I've seen several stories online and even spoken to a few people that are doing that. Packages that they help people get home, get settled, and they might spend one day with them. They might spend 3 days with them. Different rates for those packages.
Awesome. And I guess a last question that I have is for aspiring IV therapy business owners, what are the top 3 pieces, or what's just some of the top advice you would give someone just starting out?
Get organized. Get a list of all your supplies and where you order it from, and so that you can reorder quickly. You know exactly what the quantities are that you have. Get your protocols. Organize your standing orders with your medications and what your contraindications are. Get them all organized so you can flip to it immediately. It's good to have a mentor at hand. If you want a medical director that's easy to get a hold of if you have any questions, and put your best foot forward. Anybody that has been a nurse, that has been in bedside care, and even for a few years, you can walk at that bedside, you know exactly what to do. It wasn't always that way. There is a little moment there that when you're first a nurse where you've got to figure it out. You've just got to do it. So be brave and know that your bedside training will come right. It never leaves you. You don't forget how to take care of people. So it's just like stepping into a new field. Like if you went to a different floor on the hospital, it's no different. You're just a little bit more on your own. So staying organized and familiarizing yourself with what you're giving them and doing a proper assessment, and focus on safety, and you just can't go wrong. And safety, not just with the patient, but if you're a mobile nurse, safety about where you're going. Know where you're going. You don't just go anywhere, and make sure someone knows where you're at all times, those kinds of things, so that safety is for everyone on that.
Yeah, that's great. That's great advice, actually. Yeah. Well, very cool. So it sounds like you're ready. You're close to opening your clinic. So good luck with all of that for sure. If people want to learn a little bit more about your clinic and what you're doing, do you have a website up yet, or?
I do. It's www.Serenity Springs, Arkansas. It's AR, serenityspringsar.com.
Okay, and I'll put this link in there. So serenityspringsar.com.
That's it.
Cool. Awesome. Well, I really appreciate you taking the time today. I think this is super, super helpful, and sounds like, you got some amazing treatments you're going to be offering, and I think your patients are going to be in good hands. So thanks for joining us today.
All right, Ben, thanks for having me.
You bet.